want to welcome my good friend Austin, Dr. Austin. Can you pronounce the last name? I don't want to mess it up.
Bouzigard.
Bouzigard. Austin Bouzigard. See, I didn't want to mess that one up. Austin and I have become good friends in a short period of time, and I'm going to share with you guys a little story during the show today. How Austin actually saved my leg and my life last week during a chiropractic exam. So we will get deeper into that. You guys know that our show is all about health and wealth, two things you can't ever get enough of, and the two most important things out there, other than maybe family, put on that list too, but your health and your wealth go right in with your family. So you guys who've listened to the show before, you guys who haven't listened, this is your first time tuning in, we always like to also feature a local business on our show. That's another thing we're really big on is community growth and business growth. So Austin fits multiple pieces of what we stand for: health, wellness, and actually local business owner here in town as a chiropractor and a doctor here in town. So yeah, Austin, tell us a little bit about yourself, where you guys are located, and let everybody know who you are and again where they can find you.
Okay. Well, thanks for having me, Brandon. I appreciate it. I'm from Cutoff, Louisiana. Went to LSU in 2010 to 2014. Then chiropractic school in Atlanta, and then did my internship in Las Vegas, and then decided to come back to the great state of Louisiana.
I'm surprised you came back after Vegas. I don't know if I'd have come back.
Yeah, it was a tough decision, but I'd miss family and friends and everything, and home is home, and
yeah.
You can't take the Cajun out of the bayou, boy. So
you definitely can't take that accent away, right?
Yeah, no, it's not going anywhere.
But I tell you, I don't know I'd get a lot of work done in Vegas. I'd have too much fun.
You got to work hard, play hard. So.
Exactly.
It was good, though. It was a good experience.
So you said you went to chiropractic school in Atlanta.
Hot Atlanta.
How'd you like Atlanta?
I don't like the Dirty Birds. So,
no, yeah.
Saints fan, who dat?
I know. So look, I am all mixed up today. If you guys are looking on Facebook, I literally just drove in from Atlanta. We had tickets. One of my vendors is based out of Atlanta, and they gave us access to their suite for the final game. They're right next to the owner's suite. Next level. Like I thought the Superdome had some nice suites. I got to give it to the Mercedes-Benz Stadium there in Atlanta. They took it up a notch. They took the food up a notch too.
Yeah, it's nice.
So I'm mix and match. I got my Atlanta Falcons free souvenir T-shirt on with my Saints hat. I was glad to see the Saints win. As usual, the Rams have ruined everything for us. They get the fake calls, and now they can't even friggin' win a game. So shout out to you Rams fans, we hate you. And again, we'll be back next year though. We got to get Jameis healthy. We got to get Michael Thomas healthy, and then I think we got some firepower. We can make a run again. They need to get a good chiropractor. Yeah. Maybe Michael Thomas could make it through a full season if he got his back adjusted, got his knees in line, and did all the things to prevent all these injuries that he's having. So, Michael Thomas, if you're listening, we need you to get in for an appointment with Dr. Austin over here, because you're all out of alignment, and we think that's what's causing the ankle issues. At least that's my medical diagnosis.
Lack of hip mobility will cause that, so
See?
You never know.
That's it. So you guys who I've talked to, or I'm not a big, posting a lot of personal stuff on Facebook. I don't do the prayers needed. I don't do a lot of that stuff. But last week actually spent a few nights in ICU and had emergency surgery, and I want to talk about that because one thing I'm very big on is being in touch with your body, your physical health, your nutrition, and I know my body pretty well. And last Wednesday, I was working out that morning, just my normal jiu-jitsu routine and training. My calf was bothering me a little bit. Felt like some muscle tightness, and the pain by lunchtime at work got so severe. I called you, and I was telling you I think something's wrong, and I want to come by there and have them check my blood flow, my circulation, get a look at my leg. And see if this is a pinched nerve in my back or something more severe internally with some of my past injuries from my motorcycle accident. And it was worrying me to the point where you actually left work and came by on your lunch break, and we took a look, and the pain had slowed down a little bit. And this is where you really got to listen to your body and pay attention sometimes, because the circulation was okay, there was a pulse, we checked it, and at that moment it seemed like it was okay.
Yeah.
And then fast forward several hours, I came by after work and we're doing a full exam. I'm in your clinic, and I'll kind of let you take it from there during the exam, kind of let everybody know what the first things that happened were, and what obviously prompted you to say, put your clothes on, we're going to the hospital.
Yeah. So basically, Brandon walks into the office and start doing my exam and everything, and so the pain started increasing pretty severely while he was there, and take him through a few ranges of motion and doing a few different things, and I had made him take off his socks. So I felt the pulse. It was faint, but it was still there. And then next thing I did was put both my hands on both his feet and compared the two. And his right foot was way more. It was a lot colder than the other foot. So I said, "Dude," I was like, "Get in my truck. We're going to the ER."
Yeah.
And put Brandon in my truck. And he goes, "Hey man, stop at Planet Nutrition before we go to the hospital."
I was hungry.
I looked at him, I said, "Are you kidding me?" He says, "Dude, I'm hungry, man. Can you stop?" I said, "Okay."
Yeah, I wanted my smoothie.
B, what the hell are you thinking, man? Come on.
Hey, shout out to Planet Nutrition. They got the best smoothies in town. That's a free plug for Planet Nutrition right there. I was starving, dude. I hadn't eaten since lunch. I was busy at work, and so I wasn't thinking I was going to be going in for surgery. So I was like, yeah, let's get a smoothie on the way to the hospital and check out what's going on.
So we get to the hospital, tell the nurse checking him in, saying, suspecting a clot. We need to do a Doppler ultrasound ASAP. And so they brought him in and did their procedure, and then sure enough, the doc came out and says, "Dude, you got a clot in your bypass. We need to do emergency surgery tonight." And it was a real humbling experience for sure. If he would have waited 24 hours or not had done anything about it, he could have lost his leg or his life. So
yeah. So very, very serious to listen when your body's telling you or you're feeling something's not right. I'm a hard ass to the point where going to the ER is out of the question for me in most cases. This is one of the rare, luckily I had serious surgeries on that leg before, so I was a little bit nervous because of the type of pain. It was a unique pain I hadn't felt before. It wasn't nerve, it wasn't skeletal, it wasn't muscular. And it's one time when someone said, "I'm taking you to the ER," I didn't even argue it. I was like, all right, let's go. And 9 out of 10 times I would have not gone. So when he felt that strongly about it and I knew that the pain was there, it was definitely a moment that we both were in agreement. Let's go. I just had to detour off and get a smoothie on the way there. But
you were doing jiu-jitsu that morning before, so with obviously induced claudication, cramping in the calf could kind of activity could kind of increase that, and there was no blood flow getting to his calf, so causing the cramping, and so that's kind of where it started at that morning, huh?
Yeah, exactly. 6 a.m. jiu-jitsu class. I go about 3 days a week normally, and it didn't hurt much that morning. It just felt like I needed to stretch some more, and the calf was a little tight. I sat out, foam rolled it for a round, and then rolled about 4 more rounds, and then when I got home is when it got a little sore, and then when I saw you around lunchtime is when it was really getting agonizing, the pain. So we'll talk more about blood clot signs, pain, and things you should be looking for after this short commercial break. So you guys out there, stay salivated, and again, when you need a good chiropractor, come see my man Austin. Welcome back. Our second segment here. We are talking health with my man Austin here. Dr. Austin saved my life last week and definitely saved my leg. So we were talking briefly before the break, the signs and some obviously were more telling than others that there was a blood clot in the leg, and the discomfort that was coming and going and getting to a point at some points, even with my high tolerance for pain, it would get pretty excruciating.
Yeah.
And it was very centralized in the calf. And kind of walk everybody through the difference between like a sciatic nerve versus what we were experiencing, and why we knew that there was something different going on there that wasn't nerve related.
Correct.
So if you want to tell everybody.
So, you know, taking a good patient history is always very important. So Brandon had said he was doing jiu-jitsu that morning, and with increased activity, this could kind of aggravate that issue. So he was having intermittent claudication, so like cramping in the calf. And he was basically always describing that he had never felt this pain before, that something just felt different. So typically with like sciatica or lumbar radiculopathy, it's nerve pain, so it's like it's sharp, it's shooting, and it can be intermittent as well, but there's not really any cramping. It's like tightness in the hamstrings, the buttock, the low back. It's kind of stemming from that area more, but Brandon was at the office and just really pinpointing at his calf.
Yeah.
But 20 years ago, Brandon was in a motorcycle accident where he broke his femur, correct?
Right.
Mm-hmm. And then his popliteal artery needed a bypass in it. And so that was 20 years ago, and then, you know, nothing natural to the body. That's not, you know, something that's not natural that comes within us. So, you know, everything wears and tears over time. So, unfortunately, Brandon had a clot that had built up in his bypass, but thankfully we caught it and got it in time.
Yeah, absolutely. So if you're feeling that type of discomfort anywhere, you suspect anything circulatory, you know, back pains can sometimes be a sign of a blood clot in different areas. So making sure that you get that diagnosed and get that looked at, because it can be life-threatening. Certainly, you know, in the case of where mine was in my leg, it was the words I never wanted to hear from a doctor again.
Yeah.
And I heard it for a second time. You know, we're working to save his leg right now, and that's a scary feeling to hear that. And then what was kind of cool though was excuse me, this was the first time I was completely awake and got to watch my entire surgery being performed on the screen. I'm watching everything the surgeon is doing as he's doing it. I'm probably talking to him too much while he's doing it, but I was
some good pain meds.
Yes, I was absolutely high as a kite, watching on the screen in amazement and every now and then, but I could feel the stuff moving around in the leg because it was just a local anesthetic. So. Right. It sometimes you know, a little uncomfortable, but I'm watching the surgery as it's being performed, and I'm watching everything they're doing. A lot of that because I had just eaten and had a smoothie on the way there, so they couldn't put me under anesthesia. So they
poop on them.
choke to death on my smoothie. So they put me under local anesthetic. I got to watch the whole procedure. And the first day was, of course, the most intense, with doing the actual procedure, going into the leg and removing the majority of the clot, seeing how much was damaged, what the circulation issues were, and really diagnosing it. So I was in there for a few hours. Time goes by pretty quickly when you're kind of sedated like that. So I didn't realize till, I guess it was about 11 p.m. When I saw you guys come back into the room after the surgery. And definitely want to give a lot of props to Dr. Tran and his team. Those guys were amazing. And
Baton Rouge General.
Yeah, Baton Rouge General, right there off of Blue Bonnet. I would say top notch. If you're needing to go to the ER, that would probably be my top recommendation.
For sure.
I've spent too many times in a few of them, so that was the best service, treatment, and just overall accommodations I've had in any hospital. So great staff there. But going through the procedure and then talking to them and knowing what all they had to do, and that was a very, very awakening experience and something that brought back a lot of old flashbacks, old memories from my motorcycle wreck, and things you never want to relive, like being in ICU. Never a place you want to be. And but special shout out to Austin. He actually was there with my wife until midnight. I mean, you guys were there at the hospital till she's like, you don't have to stick around, but having a good doctor and a good friend that is there for you, it is definitely key. Shout out to Craig Green as well, a friend of mine I talked to. He came by every day when he was at the hospital, checked on me pretty much every morning. So having good doctors and knowing your body, knowing your health, and staying on top of that is critical. So
I mean, you might be my possible future brother-in-law. Hopefully.
Yeah,
so,
right. We
gotta stay.
That's it, man. You got my blessing. I gave Holly my blessing after the hospital incident. So after saving my leg, I was like, all right, he's a keeper, Holly. You got to keep him around. So.
Okay. But yeah, I was fortunate enough to join up with a great physical therapy group. There's not too many chiropractors and PTs that do a joint thing together. A lot of guys kind of fight back and forth between the two, but at the end of the day, it's about helping every patient to the best that you can, to their ability. And me and Al Mortal became really good friends a few years ago, and long story short, partnered up, and now we're treating people with chiropractic care and physical therapy, and it's going pretty awesome. So he's a great guy. We have a lot of different locations throughout Baton Rouge and throughout Louisiana.
Where are you headquartered, or do you move to different locations?
Yeah, I'm at Blue Bonnet.
Okay.
Blue Bonnet location.
All right. That's where I saw you at.
Blue Bonnet and Highland. In between Burbank and Highland off of Blue Bonnet.
Yeah. So, that Blue Bonnet extension there.
Yeah, correct.
So again, more therapy, more physical therapy. Dr. Austin Bouzigard.
Yeah, that's it.
Got it. See that? So you guys definitely need to go see him. Best chiropractor in town. Guess the Intelligent Mortgage and the Financial Fitness, 2 thumbs up from us. So anybody that's needing chiropractic. And what I noticed about Austin was even the weeks prior was just in our conversations, just the deeper intellectual level and the sports background, and more in-depth comprehension of everything with the body, not just come in and I'm gonna crack your back and send you on your way. They do a much more in-depth treatment and a lot more specialized. So kind of tell about that, because for years every one of my back adjustments was exactly the same. Correct. And most people can't even adjust me. Like you even said, like, dude, you're like a brick. so it's different with different people, and something that you had mentioned, like the X-rays and stuff, before even really getting started. So I'd like you to kind of talk about how you go a lot deeper up front with that to better, obviously, treat and diagnose.
Correct. So. With chiropractic, it's such a broad spectrum of a profession. It's not like going to a dentist or an ortho MD, even sometimes a PT. They all kind of relatively do the same thing. But with chiropractic, you could get somebody doing, I don't even know what it's called, or it could be, more medically based, more things that are proven. There's a lot of different things within our scope of practice that you could do. So, like I said, I worked in Vegas with I was with a neurosurgeon, a physical therapist, a chiropractor, and a physician's assistant out there. And I really learned a lot from all those guys. And so I take what I do with every patient I learn from those guys, and I implement it with my patients. So we take true spinal alignment into account. So based off of x-rays, I'll look at the spinal alignment. I'll show a patient what their spine looks like head to toe, and show them what the normal alignment's supposed to look like. And then through our great physical therapists we have, I work with Dr. Brandy. She'll do some postural corrective exercises. And then I'll do my chiropractic adjustments. We do dry needling, cupping, myofascial release, functional movements, do a lot of different things. So our bodies are machines. What machine that you know of that doesn't require maintenance?
None.
None, right? So we have 250 joints over 600 muscles in the body. So just like any other machine requires maintenance, our bodies need maintenance. But what people don't realize is the less stress on your mechanics, the less stress on your chemistry. Your spine runs your entire body. It tells you how to see, it makes your heart pump, your lungs breathe, digest your food, it moves your fingers, your toes, it does everything. So the less stress in your spine, the less stress on your chemistry. So it's not just about aches and pains, it's all about prevention, treating the cause, not the symptoms.
Absolutely. So we're going to take a short commercial break, and we're going to come back with more from Dr. Austin Bouzigard, talking Moreau Physical Therapy, and again, the best chiropractic treatment in town. So you guys stay tuned. Welcome back. We are in the second half of the show here, and we are talking chiropractic and also just overall maintenance and wellness on your body. Something that I am really big into is of course your health and wellness. Something you mentioned, and I want to make sure we get back to that, is the prevention and kind of how everything starts at the spine. I mean, it is the nerve pathway for your whole body.
Your breaker box. Imagine a breaker box.
That's a good way to put it.
Yeah.
So kind of tell everybody, what kind of things you recommend, and what do you guys look for when you're treating? Because what I noticed was your initial assessment and the things that you required before really even doing adjustments were things that I hadn't had done before. X-rays and that sort of stuff before you really would start working on somebody.
Okay. Well, just depending on what the patient comes in with, like I said, you always want to do a thorough exam. But we could just take an athlete, for instance. They have whatever, low back pain. So always do a thorough exam, different, ranges of motion testing, things like that. But it's real important for me as a practitioner to take x-rays. You're not going to would you let a mechanic diagnose your car before popping the hood?
Right.
Exactly, right? You want to pop the hood, see what their spine looks like. But 90% of the population has a short leg due to a growth plate fusing quicker than the other. So for instance, pretend we're building a house. You want a level foundation for your slab, right? What happens if the slab's off? How you think everything else affected building up would be affected, right?
Absolutely.
It would tilted, things like that, things would fall apart. So our pelvis is our center of gravity. So based off that x-ray, I'll take a few measurements to kind of see where their pelvis is, if they're level or unlevel, and then determining that is going to determine how much curvature they should have in their spine. So we'll take A to P views, lateral views, and kind of compare, like I said, between what a normal spine looks like and what their spine looks like. And then it's all about restoring motion back to where it needs to go. So our bodies are like machines. So it's real important that I know exactly, I want to be real specific where I'm adjusting at, or where we're doing soft tissue work at, postural corrective exercises, taking the body as a whole into account and not just focusing on the symptom and treating the cause of the issue.
Yeah, no, that's huge. I definitely, I laughed the other day when you were at the house. My little boy was sitting there looking at his phone, and you're like, pick the phone up, sit up straight.
Text neck.
Yeah, text neck.
So not just with a macro trauma like a football injury or some major car accident, something called gravity is constantly working against us every day. So my whole philosophy is better posture, better health. So how you have a better posture is the things that we do in the office.
Yeah.
But your diet comes into account, exercise. I can only help someone so much if they're going to sit down on their butt all day and eat McDonald's. It's all about reducing stress and inflammation from within the body.
Yes.
And then with that, great things come with that. So.
Yeah, absolutely. Eating right is critical.
For sure.
And then maintaining the machine, like you said, the joints, the back, everything starts there. What you said about the pelvis, though, is something I definitely know from my injuries and from having knee surgeries and a broken femur, that sort of thing, how out of whack my body gets now after a few months, to where I've got to realign everything just because one leg is longer than the other, and my pelvis tends to be tilted from
anterior pelvic tilt, posterior pelvic tilt, different things. So based off the x-ray, I could see all of that. Right. And then start doing postural corrective exercises and adjustments and different other modalities to help restore motion back to where it needs to go.
Yeah, because my range of motion is terrible from my accident. So I'm looking forward to getting into some normal sessions.
Not have to be rushed to the ER.
Yeah, our first one was quite exciting. But I would bet that most, because I've been to a lot of chiropractors, would have just adjusted my back, tried to adjust my lower back and see if that relieves some pain on the nerve. And we probably would have never even stripped down to examine the leg, examine the feet, and go that deep into it. Because I've never gone that deep into an exam during a chiropractic appointment before. So definitely saved my life and worked out well. So guess you dating my younger sister happened for a reason.
Yeah, I guess so. Yeah, everything happens for a reason. So
that's it. My wife's big on that. I was like, yeah. So this worked out pretty well. So we hopefully Holly's still listening out there. So then if not, you can replay this. Like I told her, she's got to keep you around. When I was a little loopy, I sent some pretty emotional texts to everybody. When you can't sleep for like 3 days straight in ICU and you're on all those meds, you're like, just want to let you know, man, I love you.
Oh man.
Yeah, if you got some heartfelt messages from me, it just means you're really special. I was thinking about you. Texting friends of mine that I'd seen were like had surgeries recently. I'm like, how you doing, man?
But yeah, still here, still living, so
yeah,
we're good, man.
Good things, man. Bright future. It's 2022.
Yeah, it's crazy.
So,
I made 30 last year, so I'm climbing up, man.
30.
Feels weird.
Young doctor. So Holly, hold on to that one. He's a young doctor. There's gonna be competition. So, 30 years old, man. That's impressive.
Yeah, it's
That's
crazy.
impressive. So, I feel old, man. I'm gonna be 42 in a couple weeks.
Yeah, it's just a number, huh?
I don't feel it. I don't want to admit it. That's why I keep ending up injured, though, man. Like they had a good meme. It was like the number one cause of injuries in old men is thinking they're young men. So,
I don't think that. I know I'm old. I'm not trying to believe I am young. I'm going to be 50 this year.
50, Charles, the big 50. When's the big day?
December 23rd.
Hey,
Oh, okay, the end of the year. So we got time to plan a party.
Yeah.
We got party planning time for
We're
that.
going to Vegas? You want to go to Vegas? Let's go to Vegas.
I'm in. For years I've been saying I'm going to take off from Christmas Eve till New Year's, and every year I'm busy as can be. I want to hit my goal this year and do that week off.
You gotta make that happen, but you're too busy during the year, man. You need that time.
Ebenezer Scrooge every holiday.
Same.
I'm working like Christmas Eve, I'm working New Year's Eve, I'm working late, and I never take off, and everyone else is slacking off, and I think that's why, because I'm picking up everyone else's slack at the office.
That's funny.
So again, let's remind everybody where you guys are located, phone number, website, because I definitely want our audience to have the ability to listen to this again, and those who are listening live right now be able to find you guys.
For sure. We have multiple locations throughout Baton Rouge, but it's Moreau Physical Therapy, or you can go to the website moreauphysicaltherapy.com and see all our different types of providers and what we provide in all the different types of offices. But growing as a company, and we have a lot of different great practitioners within our offices. But I'm located at the Blue Bonnet location. I'm the only chiropractor within Moreau.
The group.
So the whole plan is to grow physical therapy and chiropractic together. At least my form of chiropractic care, and train others again, under me, and just help the business grow.
Well, because you have a really good athletic background, so you also understand more of the preventative and the sports side of it.
For sure.
So I think, like you said, bringing that in with the physical therapy is a really good combination, because a lot of times we focus all on one or the other, and just like the guy I would go to for body work, I don't even call it massage because it's so intense and in depth, but he would tell me, he's like, you can go get adjusted, but until you fix the soft tissue.
Correct. Soft tissue drives a joint, so you have to work the tissue. I mean, you could get adjusted over and over, but it's that muscle in that joint playing tug of war back and forth.
Exactly.
But the more you work the tissue, the more that adjustment's going to hold in place.
Right, exactly. But most people just go get adjusted and don't do any of the other measures, don't do any of the other things, muscular, physical therapy. So doing that full balance to really get your body in line and in sync is key. So, I think that's something that you guys have thought of and putting chiropractic in with the physical therapy. I don't know that many places in town, if anyone else has that.
Not that many.
Yeah.
But I'd just like to hit on, no matter what the situation, what your health issue is, popping a pill is never going to fix the issue. It's great to have medication, not against it in any way, but just know that you're just treating your symptoms and not the cause of the issue.
Right.
So from any autoimmune disease to aches and pains to even cancer, there's holistic remedies out there that big pharma controls our entire country, and how they like it. I'm helping people with my hands rather than popping a pill.
Yes.
So it's great to have that. You need to relieve symptoms at times, but it's when you become reliant on it and constantly taking this, thinking you're helping yourself, you're doing more damage than good.
Yeah, I'm not a big medication person at all. When they told me, they were putting me on blood thinners, and I was like, I don't want to be on that for long. Yeah, that was the first thing I said. I said, I'm not staying on blood. I'm not going to live my life on blood thinners, which I might have a little conflict there with the vascular doctors on that. But again, like you said, I don't want to live dependent on expensive medications that have a lot of side effects.
Correct.
I'd rather a healthier, better way of eating right, exercising, and going to like I do now, quarterly blood donations. I go donate blood every quarter, and that thins out my blood, and it's healthy for you. So, I want to look at other alternatives, and that's some discussions I'm going to have too, because I don't want to live on blood thinners after this incident. So we got one more segment. You guys stay tuned before we close out the show. Welcome back, our final segment here. We are kicking off the new year with my good friend, Dr. Bouzigard, Mr. Austin Bouzigard, the best chiropractor in town. Now he can add Lifesaver to his resume. Saved my life last week, so definitely going to be coming back for more treatment and some normal treatment. Yes, yeah. So let's talk about that, preventative measures and kind of routine treatment. What do you recommend? Some of the things, like you talked about posture.
Correct.
At the workplace, like the standing desk, or like the ball, like some of the different stuff.
So in my world, sitting's the new smoking. So someone who has a desk job all day, they're constantly being compressed to that chair, they hunched over, typing at a computer, rounding shoulders, forward head posture. So over time, doing the wrong motion or repetitive stress over time, it's going to catch up to you.
Absolutely.
Whether, just like smoking or anything else, right? So coming out of true spinal alignment places stress on the body. So we want to reduce stress and inflammation from within us, because it allows the body to work better.
Yeah.
So
I bought a couple of those tables at the office, the desk that are motorized, that come up and down, so you can sit or stand.
For sure.
So it's like a standing workstation. You can adjust the height, because you and I would probably work at a different height level if we were standing. So do you recommend standing part of the day or most of the day, if you can obviously talk about that?
Absolutely. Standing at a desk is great. Also recommend for patients who don't have that is a big therapy ball.
Okay.
Whether take their whatever their height is, they have 75 centimeters, 65 centimeters. Those are kind of the two I'll work with.
Okay.
And instead of sitting in a chair, which allows you to slouch, you sit on a ball, and it makes you tighten your core and sit up straight. See how we're both kind of slouching right now? Well, the ball makes you sit upright.
And is that different than like the ab ball that you do at the gym?
No, that's it. Yeah. It's not the medicine ball. It's not heavy. Yeah, it's just the big ab.
Yeah, like the big
round. Yeah, that's it. Yeah.
Just one of those.
Just one of those. $20 on Amazon.
Yeah.
No big deal. So that's it. But it'll save you back trouble for sure.
So all of you guys at the office, I'm not buying any more $500 office chairs from the office supply place. I'm buying exercise balls. I just cut my budget.
Yeah.
See, look at that.
Saving money too.
Yeah. So business owners, if you're listening and you have to buy chairs for the office, just buy exercise balls. You're actually doing a healthy service to your employees.
Exactly.
And you're going to save yourself thousands of dollars, because chairs, people don't realize who've never owned a business.
Yeah.
Office chairs are ridiculously expensive. So I like that. I'm getting exercise balls for putting. I can do some abs while I'm at the office in between, like on a break or something.
Yeah. So one analogy I'll make to a lot of patients is, do you wait to brush your teeth until you have a cavity? We all brush our teeth to prevent, right?
Yeah.
So just like your teeth decay over time, your spine decays.
Yeah.
So the more maintenance you keep up with your spine, and the more you stay in proper alignment, the longer you prolong that arthritic process from shedding in the body. So whenever you come out of alignment, there's more stress on that bone, there's more stress on that disc, there's more stress on that nerve root, and the way a nerval synapse at the mitochondrial level of a neuron, it won't stop, but it'll diminish over time the more and more you fall out of alignment. And then that nerve flow to whether it's that organ, the cell, the muscle, the tissue, it becomes inhibited over time. So starting chiropractic care from the time you were born to 100 years old, I mean, obviously I'm not going to take a baby and rip their neck, everything's cartilage. There's, there's different ways to adjust, different age groups.
Yeah.
So it's real important that if everybody would look at chiropractic care like brushing their teeth,
yeah,
you're not gonna have half the stuff wrong with you later in life, because your spine runs everything. Why not have maintenance for it?
I agree. And after Asher was sitting on his phone all day the other day, you had adjusted him at the house, like straight, and you're like, and he's like, oh man, I feel so good. Yeah. And my little jiu-jitsu master, he's like, that ought to help you with your jiu-jitsu. You should be able to move better now.
Mm-hmm.
Yeah. So even at 8, 9 years old, you get out of whack, especially when you're putting your body through that much strain and stress in sports and stuff. So that's interesting. Like you said, starting at a younger age too, and just keeping everything in sync and in alignment. And probably wish I'd have learned that at an early age, because I'm now trying to put my body back in sync.
Yeah, exactly.
As I've beat it down for so many years from sports and motorcycles and racing and just all the things we do that kind of put wear and tear on our body. Like you said, we're usually fixing it.
Correct.
Instead of preventative maintenance.
Correct.
So what other preventative measures do you like to take?
People don't realize sleep's really important, and we sleep half our life away, so sleeping in a proper posture makes a huge difference as well. Or it's not looking at these damn cell phones that have
they're the devil.
Yeah, that we don't sleep.
Back's laying on your back, your stomach side.
So,
what's ideal?
I mean, sleep's important, so a lot of people.
I'm a side sleeper.
Correct. So
even though my shoulders ache, like I just struggle to sleep, and like I didn't sleep any actually, but I was on my back flat for the 3 days in the hospital, and I just can't get comfortable laying flat on my back. Is that the best way?
So you want the spine as straight as possible. So you would proper position is sleeping on your back with your legs elevated above your heart. That's like the proper sleeping position. But if you lay on your sleep's important too. So I'll work with people however they sleep, however they feel comfortable sleeping. So if someone sleeps on their side, put a pillow between your legs.
I'll do that.
Kind of pillows around you for some support.
Yeah.
So
I did. Jen laughs because she's like, you don't want me next to you? I was like, no, I'm just trying to get comfortable and have these this pillow fort built around me and my leg pillow and all. So she's got bad knees too. So we usually share, like when we're spooning, like we'll have the shared leg pillow between both our legs and stuff. So that's good.
It also helps. I mean, this all helps with mental health as well.
Yeah.
I mean, so your brain and your spine control everything. So.
Oh my God, when you're in pain, it can make you edgy, it can make you depressed. I mean,
Absolutely.
it can really play a lot on your overall well-being mentally.
Sure.
I mean, being in chronic back pain, obviously, I mean, you see the opioid addictions and things that stem, a lot of times, these were not pillheads, these were not people who were abusing drugs.
Correct.
A lot of people I know who started out as just preventative, they would use pain meds. They did flooring work. They did things like that where they were on their knees constantly doing flooring. I had a few friends that got heavily addicted to pain meds or accidents and their back injuries and stuff. So
correct.
What's your thoughts on the use of the narcotic medicines for pain, and I know you guys do a lot to kind of get people away from that.
Correct. So this world's changing, and things that are not legal are slowly becoming legal, and trying to hint at something, but that's a better route than popping a pain pill. But it's fine for pain pills in the beginning, right? It's just chronic use of any medication, whether it's a Tylenol, Advil, hydrocodone, whatever, any chronic use of taking a pill
Yeah.
is not good for you.
So more progressive, like sports doctors.
Yeah, correct.
Exactly. I mean, and you're seeing the anti-aging clinics. That kind of what we're referencing there,
Yeah.
like steroids and growth hormone, those types of
Yeah.
things being good, in again under professional medical
for
care.
sure.
Because like people call it a fountain of youth.
Yeah.
Your body starts to break down, so you can provide those things into the body with the right medical supervision and the right dosing and get someone off of.
They actually have a company here in town. It's called Cypress Hemp. They do a lot of natural CBD stuff. It's CBD could be a little bit of a tricky. I'm trying to say it could be a little different for some people, but they have a lot of different products out there. But this is a pretty great product.
Yeah.
With Cypress Hemp here in Baton Rouge, you can actually go to the store and they could educate you on the different products that they have.
Yeah, you're seeing millions of people get relief from it.
For sure.
So I think now we're in a time, and I think our audience is probably a more accepting audience in terms of, like you said, I mean, CBD treatments and that sort of thing that are now becoming more mainstream. You see these CBD stores now, and I had some CBD roll-on, like pain medicine for my joint. Not medicine, but like a roll-on, like you would have Icy Hot instead, but it was a CBD roll-on for my knees.
You have to be careful with some companies though, because they have a lot of pesticides in the CBD. So that Cypress Hemp company I was talking about, it's all natural. Got to see the form and everything, and how they grow it and everything, and it was it's pretty interesting how they do all of that. So
shout out to Cypress Hemp, and we got less than a minute left, so just remind everybody where to find you, and again, thanks for being on the show tonight. Awesome.
I'm located at Moreau Physical Therapy off Blue Bonnet, and just if anybody needs to come on in, just let me know.